Nisoldipine, also known by the brand name Sular, is a medication used to treat high blood pressure, also known as hypertension. By lowering high blood pressure, Sular helps to prevent strokes, heart attacks, and kidney problems. It is a calcium channel blocker, which means it works by relaxing blood vessels so that blood can flow more easily. Sular can be taken with or without other medications, and the daily dosage and optimal timing for taking Sular should be determined by a healthcare professional. When taking Sular, it's important to follow your doctor's instructions. Take the medication by mouth on an empty stomach, usually once daily. Swallow the tablets whole, and do not crush or chew them to avoid any potential side effects. Sular comes in different sustained action forms with different strengths, so make sure to check with your doctor or pharmacist to ensure you are taking the correct dose and form. It's also important to avoid eating grapefruit or drinking grapefruit juice while using Sular, as this can increase the chance of side effects. The dosage of Sular is based on your medical condition and response to treatment, and your doctor may gradually increase your dose. Take the medication regularly at the same time each day to get the most benefit from it, even if you feel well. If you have high blood pressure, you may not feel sick, but it's important to keep taking Sular unless your doctor advises otherwise. If your condition does not improve or worsens, such as if your routine blood pressure readings remain high or increase, be sure to tell your doctor. If you experience dizziness, swelling ankles/feet, flushing, or headache, make sure to inform your doctor or pharmacist. To reduce dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. It's important to note that an empty tablet shell may appear in your stool, but this is harmless as your body has already absorbed the medication. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Be sure to tell your doctor right away if you experience any serious side effects, such as fast/irregular/pounding heartbeat, fainting, or vision changes. In rare cases, people with severe heart disease may develop worsening chest pain or a heart attack after starting this medication or increasing the dose. If you experience worsening chest pain or symptoms of a heart attack, seek medical help immediately. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. Before taking Sular, make sure to inform your doctor or pharmacist if you are allergic to it or other similar medications, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions. Before using Sular, tell your doctor about your medical history, especially if you have a certain heart problem or liver disease. Sular may make you feel dizzy, and consuming alcohol or marijuana can increase this effect. Avoid driving, using machinery, or anything that requires alertness until you can do it safely. Limit your alcohol intake and talk to your doctor if you use marijuana. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Sular should only be used when clearly needed. Discuss the risks and benefits with your doctor. It is also unclear whether this medication passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow your doctor's instructions regarding the daily dosage and the best time to take Sular. When taking Sular, it's important to be aware of potential interactions with other medications. Certain medications can affect how Sular works in your body, so it's important to inform your doctor and pharmacist about all the products you use, including prescription/non-prescription drugs and herbal products. This will help prevent any potential risks or serious side effects. For example, drugs like cimetidine, azole antifungals, macrolide antibiotics, rifamycins, St. John's wort, and drugs used to treat seizures may affect the removal of nisoldipine from your body, altering how Sular works. It's also important to be cautious of ingredients in other products that could raise your heart rate or blood pressure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen/naproxen. Always consult your pharmacist on how to use these products safely while taking Sular. And remember, never start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Sular and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call their provincial poison control center for assistance. It's important not to share Sular with others. Consider discussing lifestyle changes with your doctor that may help Sular work better, such as stress reduction programs, exercise, and dietary changes. Your doctor may perform lab and/or medical tests, such as liver function, heart exam, and blood pressure, while you are taking Sular. Make sure to keep all medical and lab appointments and consult your doctor for more details. It's important to have your blood pressure checked regularly while taking Sular. You can also learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose of Sular, take it when you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take double the dose to make up for the missed one. Make sure to store Sular at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need Sular or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.